Hello, everyone, and thank you for joining this webinar on considerations for allocating opioid settlement funds. My name is Chelsea Kelleher, and I work for Aurora Health Group, and we will be helping the Department of Healthcare Services facilitate today's webinar. Next slide, please. If you have a technical question during today's webinar, please send a direct message to Audrey Richardson from the Aurora Health team, and she can help you troubleshoot the issue. Questions and feedback can be submitted at any time via the question box on your control panel. Today's meeting materials will be available following the webinar on the DHCS OSF webpage. We should have the slides and the recording of today's presentation posted by tomorrow afternoon. Next slide, please. During this webinar, DHCS will be providing information about key considerations when allocating funds from California's opioid settlements. During the session, DHCS will provide a brief background on California's opioid settlements to date, review allowable activities with funds received from the opioid settlement, provide a list of considerations for allocating opioid settlement funds, and review unallowable activities which may not be funded by the opioid settlements. Next slide. For today, we will be taking written questions and comments. Type your questions and comments into the questions box located on your GoToWebinar control panel, and we'll be reading them during the Q&A portion of today's presentation. As a reminder, we will be selecting questions that are applicable to most or all participating subdivisions, so if you have very specific questions, please feel free to email those to the OSF inbox. That's osf@dhcs.ca.gov. If you would like more time to consider your responses to the topics that are addressed in this session, any feedback will be accepted through April 21st, 2023, also through the OSF inbox. Next slide. I want to remind you that past webinars and listening sessions are also available and can be accessed on the DHCS OSF webpage. You can find our webinars on allowable expenses from January of 2023 and our December webinar on settlement reporting requirements. Next slide. You can also find additional resources such as an allowable expenditures document, frequently asked questions, and a DHCS technical assistance request form on the OSF webpage. So please do check that OSF webpage. We'll continue to update it with new resources as they become available. And with that, I will turn it over to Sandy Snellgrove from the Department of Healthcare Services. Sandy is the branch chief of the Community Services Division at DHCS, which is tasked with overseeing the use and reporting of settlement funds among the participating subdivisions. So please move forward, Millie, and we'll hand it over to Sandy.
Thank you, Chelsea, and thank you everyone for joining us today once again. As Chelsea mentioned, we're going to go through these slides pretty quickly. We'll have opportunities for questions at the end. The overall presentation is an effort on behalf of DHCS to provide technical assistance to participating subdivisions on considerations on planning for the use of your opioid settlement funds. Next slide, please. Settlements, of course, the status of opioid settlement funds is that settlements with McKesson, Cardinal Health, Amerisource, Bergen, collectively the distributors, and Janssen Pharmaceuticals are finalized. California and its participating subdivisions have begun receiving payments. There are proposed multi-settlements with manufacturers Teva and Allergan and pharmacies Walgreens, Walmart, and CVS, collectively referred to as the pharmacies, are pending, and the deadline to join in is April 18th, 2023. Next slide, please. Once again, today's presentation will cover allowable uses and considerations for funds from the following final and proposed settlements from Janssen Pharmaceuticals, the distributors, pharmacies, Teva, and Allergan. These settlements, the new settlements, will follow the same structure with their respective state subdivision agreements, and all payments will be made directly to participating subdivisions by the National Settlement Administrator, Brown Greer, not DHCS. Next slide, please. The final Janssen and distributors and the proposed Teva, Allergan, and pharmacy settlements are structured as such. There's funds that will be in the California Abatement Accounts Fund. That's 70%. This is allocated to all participating cities and counties. And these funds must be used for future opioid remediation, as described in Exhibit E of the Janssen and distributor settlement agreements. In addition to that, no less than 50% of the funds received in each calendar year from this fund will be used and must be used in one or more high-impact abatement activities. In addition, 15% is going to the California Subdivision Fund. This is allocated to cities and counties that were initial plan of subdivisions. These funds must also be used towards future opioid remediation and to reimburse past opioid-related expenses, which may include litigation fees and expenses as awarded. There's 15% that will go to the California State Fund. This is allocated directly to the state of California, and these funds must also be used by the state for future opioid remediation. Next slide, please. Opioid Settlement Oversight Entity has been designated as Department of Healthcare Services. DHCS is tasked with oversight of California and its participating subdivisions' use and expenditure of funds, which includes monitoring the California participating subdivisions for compliance, designating additional high-impact abatement activities, conducting related stakeholder engagement, and preparing annual reports. Next slide, please. We wanted to bring to your attention that there is significant public interest related to the use of funds from opioid settlements and to ensure transparency by states. In a recent article by Kaiser Health News, this article highlights the attention that the use of these funds will receive from public and expresses concerns about funds being used in ways that bolster the public health response to the opioid epidemic. Once again, these slides will be available probably tomorrow afternoon, and you'll have access to all of the links that are in the slides. As a result, DHCS will prepare an annual written report regarding the state's use of funds until funds are fully expended and 1 year thereafter. In addition, DHCS will include information about use and expenditure of funds by participating subdivisions, including allowable and unallowable uses of funds. These reports will be made publicly available on the DHCS website each year. Next slide, please. Allowable activities with opioid settlement funds. Next slide, please. The opioid settlements took some of the criticism and lessons learned from the 1990s Tobacco Master Settlement Agreement, where states promised to use a significant portion of their settlement funds to attack the public health problems caused by tobacco use. To date, these settlements and the state's use of funds are highly criticized, since only a small fraction of those funds are spent on smoking prevention and cessation programs. As a result of these lessons, opioid settlements resulted in structured settlement agreements, which detailed expenditure requirements, including requirements to spend all funds on opioid remediation activities and only on allowable uses as detailed in Exhibit E and by California's high impact abatement activities. Next slide, please. The settlement agreements define opioid remediation as care, treatment, and other programs and expenditures designed to address misuse and abuse of opioid products, treat or mitigate opioid use or related disorders, and mitigate other alleged effects of, including those injured as a result of the opioid epidemic. Next slide, please. Exhibit E Opioid remediation activities are listed in Exhibit E of the National Settlement Agreements. Exhibit E is included in all 5 of the settlements and is broken into Schedule A, which are core strategies, and Schedule B, which are considered approved uses. Schedule B is a much longer list of many types of remediation activities, while Schedule A is much shorter, and it's a list of core strategies that really should be prioritized. Next slide, please. In addition to opioid remediation activities, California has designated 5 high-impact abatement activities. No less than 50% of the funds received by participating subdivisions from the abatement accounts fund in each calendar year must be used for one or more of the high-impact abatement activities. It's important to note that many of the activities that are outlined in Exhibit E can qualify as high-impact abatement activity depending on their focus. Next slide. California's high-impact abatement activities include provision of matching funds or operating costs for substance use disorder facilities that have an approved project within the Behavioral Health Continuum Infrastructure Program. Number 2, creating new or expanded substance use disorder treatment infrastructure. 3, addressing the needs of communities of color and vulnerable populations, which is including sheltered and unhoused and unsheltered homeless populations that are disproportionately impacted by substance use disorders. Number 4, diversion of people with substance use disorders from the justice system into treatment, including by providing training and resources to first and early responders, implementing best practices for outreach, diversion and deflection, employability, restorative justice, and harm reduction. High-impact abatement activity number 5 are interventions to prevent drug addiction in vulnerable youth. Next slide, please. DHCS has established a new high-impact abatement activity. According to the California State-Specific Subdivision Agreement, DHCS may add to the list of high-impact abatement activities. And to do so, DHCS is required to make reasonable efforts to consult with participating subdivisions. On January 26, 2022, DHCS polled subdivisions during a webinar on whether to add new high-impact abatement activity for the purchase of naloxone. That poll resulted in a 91% response in affirmation of this decision. As a result, DHCS has added the new high-impact abatement activity, number 6, which is the purchase of naloxone for distribution and efforts to expand access to naloxone for opioid overdose reversals. Next slide, please. Considerations that we would like to see participating subdivisions take for opioid settlements. But right now I'm going to turn it over really quickly to Chelsea at Aurora Health for a poll question. Chelsea?
Great, thank you, Sandy. So before we dive into the set of considerations that DHCS would like to provide to participating subdivisions, we did want to do a quick poll and just see a little bit of information about the planning process that subdivisions are taking so far as they plan for the allocation of their funds. And so I have the poll question here, and we'll go ahead and put it up on the screen. Millie, if you can post that poll screen. The question is, has your subdivision engaged in a community planning process for the use of opioid settlement funds? And so the options are yes, no, but we plan to, no, and we have no plans to do so, or not sure. So we'll give a minute for folks just to go in and select the option that applies to your community. And while we're waiting, we'd also like to hear from you about your subdivision's process for allocating opioid settlement funds. So While we're waiting, if you can provide in the chat any information that you'd like to share about the process that your community is taking to planning for the use of funds, we'd like to hear some of those examples, and we can share them out with the group during the Q&A period. We'll just give a couple more seconds for folks to go in and record their responses. All right, Millie, if we're getting close on response rates, if you want to go ahead and show the results. All right, well, it looks like we have a bit of a mix here. So 13% of you said that yes, you have engaged in a community planning process. 26% said no, you haven't done so yet, but you plan to do so in the future. 18% looks like no, and you don't have plans to do so. So if that's you and you're in that 18%, we'd love to hear a little bit more about that. You know, why are you not planning to do so? Give us a little bit of information. We'd love to hear more. And then it looks like a good proportion of folks are not sure. So maybe an opportunity there to check in with your community counterparts, your city or county council, city council members, and learn more about what may be going on in the community and what that planning process will look like. So thank you everyone for participating. It's really helpful to hear that feedback. And like I said, please, if you have information to share about your community's process, put it in the chat box and we'll share some of those examples during the Q&A portion of the call. So with that, I'll turn it back to Sandy to continue the presentation.
Thank you. Next slide. Again, this next series of slides are ideas and considerations when selecting particular uses and expenditure of opioid settlement funds. The structured settlements had a lot of funding flexibilities built into those, and settlement allocations and expenditures will need to be tracked separately and reported to DHCS. The flexibilities include that participating subdivisions may choose to opt out of direct payments, transfer their payments to another participating subdivision, and or roll over or encumber funds to use later. We are aware that there are a lot of cities and maybe some of the smaller California counties that to date, the year 1 and year 2 distributors and Janssen payments have not necessarily been a significant portion of funds, which is why we just wanted to breeze through these slides for things that you can consider if you have a smaller portion of funding payments that have been allocated to you through the settlement agreements. Next slide, please. Opting out of payments is something that participating subdivisions that are cities can opt out of receiving direct payments of funds, which would then direct their allocation to the county in which the city is located. Cities that have opted out of receiving direct payments do not need to report to DHCS during reporting periods. Cities who want to elect direct payment must notify the National Settlement Administrator, Brown Greer, at least 60 days prior to a payment date. Next slide, please. Another consideration is transferring to other participating subdivisions. Participating subdivisions may agree to reallocate their shares of abatement account funds among themselves, provided that any direct distribution, so if you're planning to take your funds that have been allocated and transfer them, they must be to another participating subdivision. That's part of the settlement agreement. And the receiving participating subdivision must agree to the share being reallocated to them. Such transfers will need to be reported to DHCS during reporting periods, and it must include the amount of the transfer, and both the transferring subdivision and the receiving subdivision must report the transfer and receipt of those funds. Next slide. Another consideration is rolling over or encumbering funds. Participating subdivisions may roll over funds from previous years and or encumber funds for future eligible activities. Those funds must be expended or encumbered within 5 years of receipt or 7 years for capital outlay projects. In essence, funds received during 2022 must be spent or encumbered by 2027, that's 5 years, for non-capital outlay projects. Or funds received in 2022 for capital outlay projects would need to be expended by 2029, 7 years. Any funds that are not expended or encumbered within these timeframes must be returned to the state. Next slide, please. DHCS would like participating subdivisions to consider best practices when allocating their funds for uses. Participating subdivisions should consider investing in evidence-based practices with a focus on those that are listed in the California High Impact Abatement Activity and the core strategies in Schedule A of Exhibit E. Consider supplementing current successful efforts. And in addition, create a transparent process for planning, which includes engaging people with lived experience, people working in substance use disorder prevention, treatment, harm reduction, and recovery, so that you can better understand community needs. Next slide, please. In addition, prioritize strategies that are listed in Schedule A, which are the core strategies. These were identified and put into the structured settlement agreements. They are considered core strategies that we'd like to see in the state of California being implemented. Core strategies can be found in Exhibit E or in the allowable expenses resource that's on the DHCS California Opioid Settlement Funds webpage. In addition, Johns Hopkins School of Public Health created a resource, has more information on evidence-based programs and those programs that definitely would fit within core strategies. Also, ensure that at least 50% of the funds that you received within each calendar year are spent on high-impact abatement activities. It's important to note that many of the activities that are outlined in Exhibit E can qualify as high-impact abatement activities, depending on their focus. Next slide, please. Evidence-based strategies, there is a substantial body of evidence demonstrating successful interventions for opioid use disorder. Subdivisions should use this information to make funding decisions. An example of that is medications for opioid use disorder. They are proven to increase retention and treatment and reduce the risk of overdose. If you're looking at a strategy which would include funding treatment within your local area, subdivisions should consider organizations or treatment providers that provide or endorse the use of medications for opioid use disorder. In the slide, we have some resources that can help identify evidence-based strategies. Once again, these will be available tomorrow, and you'll be able to link to these resources. Next slide, please. Subdivisions should consider to supplement current efforts in your community instead of maybe creating new programs or supplanting efforts that are already in existence. Look for organizations that are already doing opioid remediation work in your area. Connect with them to learn about their needs. There are many organizations and entities who are likely working on this, including county public health departments, behavioral health departments, harm reduction programs, syringe services programs, local opioid coalitions, local substance use disorder treatment providers, local hospitals and clinics. Next slide, please. One consideration is to also connect with your public health and or behavioral health department and discuss which current programs can benefit from opioid settlement funds. We've included the directory of all county behavioral health departments and county public health departments across the state. These departments are already most likely funding successful efforts around opioid remediation, and opioid settlement funds could be used to supplement this work. Next slide, please. Once again, many counties contract with or directly provide substance use treatment. So consideration might be connecting with your county behavioral health department to learn more about those already existing efforts. In addition, Department of Healthcare Services is already funding through federal pass-through dollars through the Substance Abuse Prevention and Treatment Block Grant. This includes local Friday Night Live and Club Live prevention programs, perinatal set-aside, meaning perinatal services for pregnant and parenting women, adolescent and youth treatment programs, substance use disorder prevention, and other substance abuse block grant discretionary funding that's being utilized for a variety of behavioral health programs that have an opioid focus. Next slide, please. Also consider local harm reduction programs. There are currently 68 authorized syringe services programs statewide, and they work directly with people who are currently using drugs and at greatest risk of overdose. We've provided you a link here to this syringe service programs directory that's located on the California Department of Public Health website. They provide, among other things, of course, the following Exhibit E activities, which is naloxone distribution and training, access to sterile syringes and other harm reduction supplies, warm handoff programs to trusted community services, including treatment. And many of these local harm reduction programs are also providing medication for opioid use disorders. Next slide, please. This is a list of California counties that have syringe services programs. It's important to note also that although you may not have one in your city or county, these programs may provide services within your area. So meaning that the reach of this program may extend into your local community. Again, there's a link to this that'll be in the slides. It's also available on the California Department of Public Health Service. Next slide. Also, consideration is there are many local overdose safety coalitions. Right now, there's over 50 local coalitions that provide community outreach, overdose awareness and education, and naloxone and distribution training for people who do use drugs, adults, youth, and parents. Coalitions provide approaches in communities to address overdose prevention, and they consider the diverse makeup of local communities. Coalitions build strategic multi-sector community partnerships to address the opioid crisis and are a great resource in identifying the existing opioid-related work within communities and critical gaps where more opioid-related work is needed. We've also included a link in the slides to local opioid coalitions that you may consider working with. Next slide, please. This slide contains some examples of coalition projects. This is information from California Department of Public Health. And over the last 3 years, these coalitions have had a major impact with opioid prevention efforts in the communities they serve. These coalitions have developed innovative projects and have an important role in providing overdose prevention in their communities. This slide provides a few innovative projects these coalitions have led and have been shown to be effective. Subdivisions may want to consider reaching out to local opioid coalitions in considering use of funds or simply by funding a local coalition. Next slide. More local partners to consider. California Bridge is one of them. There are substance use disorder navigation programs at local hospitals across the state. California Bridge provides low barrier access to substance use treatment through hospital emergency departments. There are also substance use navigators who work with patients to connect with follow-up treatment in the community. California Bridge hospitals, many California hospitals in the California Bridge program provide medication for addiction treatment in the emergency department. The link that's provided here will take you to the webpage where you can learn more about this work and search for participating emergency departments. Also, consider reaching out to your local treatment organizations. It's a great opportunity to expand substance use disorder treatment and treatment for opioid use disorder within your local community. These links that are provided here can help you locate treatment providers in your area or that serve individuals in your area as well. Next slide, please. Funds from opioid settlements will flow to California for many years. DHCS encourages a thoughtful planning process for the use of funds. When doing this, have a transparent process. Invite or set aside a number of seats on planning efforts to include individuals with lived experience. Seek input from a wide variety of groups, including substance use disorder treatment experts, youth serving organizations, law enforcement, community and social service organizations, and other organizations that might have an investment in opioid work. Include your local city or county departments that may provide opioid remediation services or activities that are outlined in both Exhibit E and California's high impact abatement activities, and solicit information or public feedback on plans for use of funds, including community members with unique perspectives. Next slide, please. We wanted to also provide some considerations for spending on law enforcement. Next slide, please. Exhibit E law enforcement activities fall into the below categories, all of which must focus on opioid remediation, and this includes education and training for first responders related to opioids, diversion activities, which we'll get into a little bit more in the next slide, warm handoff overdose response programs, meaning upon an overdose response, projects or programs that include warm handoff to local community resources, including treatment. Naloxone purchase and distribution, treatment within corrections or transitioning into community, drug take back and disposal programs, and wellness for first responders, but this must be specifically related to an opioid response. Next slide, please. California's high impact abatement activity number 4 includes diversion of people with substance use disorder from the justice system into treatment, which includes by providing training and resources to first and early responders, implementing best practices for outreach, diversion, deflection, employability, restorative justice, and harm reduction. This would be an activity where 50% of your abatement accounts fund could be spent. Next slide, please. So what is diversion? Diversion is a term used to describe intervention approaches that redirect individuals with substance use disorders away from the criminal justice setting and into treatment, recovery, and other support services. These strategies include pre-arrest, pre-arraignment, and pre-trial activities, and are ultimately aimed at directing an individual towards a treatment or care program as an alternative to imprisonment. More information is included in the slides here on examples of deflection and pre-arrest diversion to prevent opioid overdose. And addictionfreeca.org includes information about opioid treatment in California's jails and drug courts that are in existence right now. Next slide. Unallowable law enforcement activities would include search and seizure or testing of illicit substances, equipment or personnel costs for gathering evidence for prosecution, officer health wellness services if they're not specifically geared toward opioid-related harms, and any training that's unrelated to opioid remediation. Next slide, please. And this is not necessarily considerations for law enforcement, but general unallowable uses of opioid settlement funds. Next slide, please. Activities not allowable include settlement funds to cover administrative costs that are not considered reasonable or are beyond 10%. To pay salaries and benefits of individuals not performing opioid remediation activities, to pay for non-FDA approved medications, any medical services or services not related to treatment of a substance use disorder or mental health conditions, or to develop infrastructure or invest in equipment not directly related to prevention, treatment, or recovery services, or other expenses not directly related to opioid remediation activities. Next slide, please. All right, this brings us to questions and answers. Next slide, please. Chelsea, am I turning this over to you here?
Yep. Thank you, Sandy. So we will take a few minutes here to pose some of the questions that folks have been putting into the chat. But before we do, I wanted to just read some of the examples that came into the chat box from subdivisions about their process for allocating opioid settlement funds. So I want to just read a couple of those examples now. A couple of the subdivisions wrote in saying that they had engaged their local opioid coalition. So that was what Sandy was talking about on the slide about local opioid coalitions. It sounds like a couple of subdivisions have engaged with those local coalitions and are working with them to bring together stakeholders in the community. One said that they're sending out a survey to stakeholders prior to an opioid coalition meeting and using those survey results and planning meeting discussion to lead a plan for how to use the funds. So sounds like a couple of folks are really using those opioid coalitions in their area. Another subdivision, Burbank, California, says that they have formed an opioid working group with stakeholders to gather information about needs and gaps and the best use of funds in their jurisdiction. So bringing together a stakeholder group. Another subdivision says that they have had meetings with their sheriff, social services director, and public health director, as well as CAO, and they will be providing a presentation to their board of supervisors during a board of supervisors meeting and will be receiving public input there. So again, bringing together various entities in their community that have a stake in opioid prevention work. And another interesting response from one of the subdivisions who noted that they have met with their neighboring subdivisions to consider a plan for their greater community. So an interesting example here, and definitely there are some places in California, cities close together who may be receiving these funds, where it makes a lot of sense for you to kind of come together and think about collaboratively what to fund in your communities. So a really interesting example there, and thanks for sharing. One subdivision noted that they found a barrier to putting together a community planning process. This subdivision notes that the deadline of June 30th to expend the funds has prevented efforts to engage in a community planning process at this time. So I'm wondering too if Sandy's information about the ability to encumber funds to set them aside to use later might provide some help to this subdivision and putting together that community planning process and having a little bit more time to think and plan for how to use those funds. So again, thank you all for sharing those examples. It's really helpful to hear about those, and feel free to share any more that you'd like to so that we can continue to highlight those types of examples. All right, turning to Q&A, I want to highlight some of the questions that we've also received in the chat. So Sandy, I'll pose the first question to you. One of the attendees asks, are we required to submit our proposals for the use of settlement funds? Can we move forward with a project that we believe meets the requirements set forth by DHCS?
Yeah, good question. Participating subdivisions are not required to submit their proposals to DHCS for approval, but those interested in receiving technical assistance to ensure that it would meet Exhibit E and the California specific subdivision agreements, it might be in your best interest to just maybe submit that to us for some technical assistance and guidance, and even engaging in conversations about those projects might be helpful, but it is not required.
Great, thank you. We have another couple of questions related to encumbering funds or rolling over funds. One of the questions is, can cities encumber the funds prior to June 30th, but spend the funds after June 30th, so long as they are encumbered? And a similar question, can the funds for year one be rolled into year two? We want to spend the money, but the timing has been difficult.
The short answer is yes. And if you have further questions about that, you could reach out to osf@dhcs.ca.gov, and we can provide you more guidance on that. I also want to point out too, on the DHCS Opioid Settlement Funds webpage, we also have also done maybe three other webinars, and you have access to those slides as well as the recordings from those presentations. Those presentations include a little bit more detail on expenditures, reporting, and those types of things. And so I would encourage those subdivisions who have not seen those to do so. Thank you.
Great. Another person asks, are the allowable expenses for the Walmart, CVS, Teva, Allergan settlements exactly the same as the Janssen and distributor allowable expenses, including the 50% going toward high impact abatement activities? So Sandy, do you want to talk a little bit about the kind of state subdivision structure and how it kind of mirrors the Janssen and distributor structure for these new settlements as well?
Yeah, the California state-specific subdivision agreements that are proposed right now on the Office of Attorney General's Department of Justice webpage are structured the same as Janssen and distributors. Although those settlements and those state-specific agreements are not necessarily final at this point, they are proposed to be structured the same.
Thank you. Another person asks, would staffing time for a high impact abatement activity program be eligible for funding? So to clarify, would it be allowable to pay for staff time to implement a high impact abatement activity program?
Yes. Yes, as long as the staff or personnel are directly involved in an opioid remediation activity that's allowable per Exhibit E or California's high impact abatement activities, the answer would be yes.
Thank you. And another question, would Narcan kits be an acceptable use? Would that be an eligible expense?
Yes, and also with the new high impact abatement activity number 6, the procurement of naloxone for distribution, 50% of your high impact abatement activity requirement could be met through this activity.
Great, thank you. Another person asks, are participating subdivisions required to report on how they're using the funds? And if so, is that information publicly available?
Yes, and if you go to the DHCS Opioid Settlement Funds webpage, you will see an array of resources, including the state-specific agreements that outline the requirements for participating subdivisions to do annual reports to DHCS. DHCS is currently in the process of building a reporting portal, and that is upcoming. Training will be provided on that as well. And so, yes, the answer is that. Did I answer that one, Chelsea? All the way?
Yeah.
Did I miss something?
Yeah. Just that DHCS is creating that form, and I think one of the planned webinars that'll be coming up in the next couple of months will be a walkthrough of what that reporting form will look like.
Okay. Yeah, and also on our webpage as well, there are the last couple webinars that we have recently done. The slides are available and the recordings, and those presentations have more information on all of the reporting requirements.
Another person asks, how do we submit activities to be reviewed by DHCS?
On our webpage, we have guidance on receiving technical assistance. It includes a technical assistance form that would need to be completed by the subdivision. The more information that you give us is very helpful. So instead of more generalized responses, it's best to kind of provide us a little bit more detail as what you're really thinking about utilizing the funds for. The instructions on how to submit that technical assistance form are also on the webpage. And those are all resources that are there now and available for you.
Great, thank you. Another person asks if subdivisions will be required to report expenditures by fund, such as abatement funds or subdivision funds, or by individual settlements. So breaking it out by Teva and Allergan, distributor and Janssen, et cetera.
Yes, as of right now, the requirements would be to report all the funds that you've received from each settlement and your expenditures per settlement and per fund account. More on that will come in our upcoming webinars. And again, more detail on the reporting requirements are on our last couple webinars.
Another person asks if you can define encumbering or obligating funds. They're wondering if the funds are in a plan, are they considered encumbered, or are you referencing an accounting term of funds reserved in a purchase order?
If we could get that one taken off so that we could address that and maybe some FAQs, I think that would be very helpful.
Definitely. Another person asks about prioritizing core strategies and I think they're looking for a little bit more information about what DHCS means in regard to prioritization. They have a specific plan to use the funds that falls under Section B, but they're looking for a little bit more information about the prioritization of core strategies in Schedule A.
Yeah, thank you. That's a good question. I just think that it was sort of the foundation of the settlements and how they were structured is that it was identified that there are some specific core strategies that have been shown and proven to be successful, or core strategies to address the opioid epidemic. It doesn't mean that you're required to spend your funds in a core strategy, or whether it's a portion or all of your funds in a core strategy. Schedule B does provide a list of approved uses, but we're just sort of emphasizing the structure of the settlements to say that they are core strategies by the very nature of the way that were identified in Exhibit E, but Schedule B uses are also allowable.
Great, thank you. And I know, Sandy, we have a couple more slides to go through to wrap up, so I'll just ask one additional question. This person is asking if they're behind because they haven't reported anything yet on their the receipt of funds or spending of the funds. And so I'm wondering if you can talk a little bit about what DHCS is planning in terms of the time period of when the subdivisions would be required to report on the use of funds.
Yeah, I think this is a great question. And again, I would encourage those that may not have participated in our last series of webinars to do so, well, to go back and review slides and or the recordings. But no, you haven't missed anything. Their national administrator was a little bit behind. And so for Janssen and distributors, starting in November up until very recently, both distributors and Janssen's year 1 and year 2 payments were just received by both California and California's participating subdivisions. The reporting periods will be per fiscal year. So the first report will be for any funds received or expended during this fiscal year, 22-23. And that report, all of the reporting deadlines are in those other slides that we have on the DHCS website. But you would be reporting, I think our date, Chelsea, was September 30th would be the due date. So as of between July 1st and September 30th, subdivisions would be reporting on the funds they received and their uses and expenditures for the prior fiscal year.
Great, thank you so much, Sandy. And thank you everyone for those questions. As a reminder, the slides from today as well as the recording will be posted tomorrow afternoon, and we'll also send out an alert to the listserv that those materials have been posted. So just want to make sure that you have those available to you, and we will be sending them out tomorrow. And with that, I'll hand it back to Sandy to wrap up today's session.
Fantastic, thank you, Chelsea. Next slide, please. Next steps on opioid settlements. Next slide. Just wanted to remind everybody of the upcoming settlement sign-on date. The proposed multi-state agreements with manufacturers Teva and Allergan and the pharmacies Walgreens, Walmart, and CVS are currently pending. The deadline to join these proposed settlements is April 18th, 2023. This information is available on the Department of Justice Attorney General's Opioid Settlements webpage. But if you have questions about this, please check with your local city or county council. Next slide. We do plan to have some more webinars. These will be something that we're doing ongoing as we learn more about the settlements and as we continue to work together, California and its participating subdivisions, on expenditure and use of opioid settlement funds. Some upcoming planned webinars include topics like opioid settlement guidance for participating subdivisions, examples of city and county opioid settlement funded activities, and we will also be doing the expenditure reporting forum training. If there are topics, though, that your subdivision would like to see, we would be really interested in hearing from you. What is it that you need from DHCS, and how can we be of assistance to you as you consider and plan on the use and expenditure of these funds? So please, any suggestions or any proposed topics, feel free to send to our Opioid Settlement Fund inbox at osf@dhcs.ca.gov. Next slide, please. Next steps from today, of course, is that we'll compile feedback and questions provided through this session. Technical assistance and guidance documents will be provided to clarify information related to the oversight of the opioid settlements. Next slide, please. I just wanted to remind everybody that also these slides and this recording will be made available hopefully tomorrow afternoon. And all of the information that we've discussed in today's webinar, past webinars, including other resources that DHCS has developed for use of opioid settlement funds, can be found on the DHCS OSF webpage. And again, any additional questions, please feel free to email us at dhcs.ca.gov OSF. Thank you. All right, and we wanted to thank everyone for your time today. We appreciate your attendance and participation, and we look forward to our continued work together. Thank you so much.